Oh, we already have.
Daniel, can you put it on slideshow mode?
It's on a slideshow. Yeah, it should be. Can you see it on a slideshow?
Yeah, can you change the setting to duplicate view in the display setting?
Display settings. Yeah.
Yeah. Yeah. How is it now?
Yeah, perfect.
Okay.
You can begin. Thank you.
Well, I guess that we are live. Are we live, Patrick?
Yes, go ahead, please.
Oh, hi. Good morning, everyone. Let's start the session. First of all, welcome everyone to this skill building session. Good morning, good afternoon, or good evening, depending on the part of the world where you are. We are delighted to start this session on how to use system thinking at the district level. My name is Daniel Cobos. I work as a scientific collaborator at the Swiss Tropical and Public Health Institute. And I'm surrounded by a fantastic group of panelists that will give us all insights on how to use system thinking tools for at the district level to improve district health system performance. So as for a start, we would like you to just I would like to mention that please engage in the discussion forum. I've seen that there are already comments in the discussion forum, and we really like that. Please, if you want, put your name and contacts there so that we can reach out to you in the future. If because we definitely want to connect with you. We want to create a community of system thinkers, and this session is part of it. So please engage in the discussion forum, in the Q&A. And there will be opportunities for all of us to discuss. So no worries, this session will have 2 hours, so we have plenty of time. And as the first way of engaging with you, we would like to ask you whether you are a system thinker. So poll should be popping up right now in your screen. And please answer if you think that you are a system thinker. I will give a couple of 1 minute. And Carmen, please let me know when we have some results.
Yes, so questions are coming in. There are around 50 votes. 51, and 86% of the people are saying that yes, they are system thinkers.
Okay, 86%. This is fantastic, because if you're a system thinker, this is your place. If you consider yourself a system thinker, this is your place. One of the things that we want to do in this session is to launch the System Thinking Accelerator. That it will be a community for all of us practicing system thinking in health systems. So, but for those of you that are not sure, for these 14% that they either don't consider themselves a system thinker or they don't know. So if you think that system stakeholders are important to understand how the system operates, or if you think that context and history are crucial to understand how the system performs today, or if you think that cause and effect, they don't usually have linear relationships, they have more complex relationships, so then you might be a system thinker. And we would like to engage with you in discussion. And if you don't think that this is important, we would also like to engage with you and understand why you think that, and to get your perspective on how health systems operates. So if you consider yourself a system thinker, please stay tuned until the end of the session, because Aku Kwame from the Alliance for Health Policies and System Research, she will be launching SysTech, the System Thinking Accelerator, where we want to create a community of all of us, of system thinkers that work on health systems. So this session is all about unintended consequences. And we hear so many times that projects that they work perfectly in one setting, that is beautifully implemented, but then is taken to another setting and they lose effectiveness or they fail. And people say, oh, but how this could happen? This is an unintended consequence. So, well, we think that with system thinking, some of those unintended consequences will be less unintended. And by consequence, it will be more predictable and probably preventable. So we want to have a clear here, we want to understand why unintended consequences. We want to predict unintended consequences, and we want to be less wrong, as some of the bigger system thinkers said. So for this, there is a body of knowledge already, looking at developing tools and developing approaches that can help us identify those unintended consequences. So, for example, if we want to look at non-linear relationships, we have causal loop diagrams. We can investigate that. If we want to look at how the network in a system is set up, how the different stakeholders relate to each other, what are the power structures, we have social network analysis. If we want to understand the end-to-end processes in a system, if we want to understand where the silos, how we can fix this fragmentation that we see all over the world in health system, we can use process mapping or enterprise architecture. And we want to account for the different factors and understand how the performance of the system depends on different factors that interact dynamically. We have system dynamic modeling, and with these tools, we can even look at the scenarios for the future. So there are plenty of tools, fantastic tools. They are out there, but when we bring them to the district level, when we bring them to district managers, to health directors of health facilities, to health professionals, they say, yes, I agree. I totally agree that we should use a systems approach, that I want to use it, but, and there are like different reasons that they give. Some of them is like, no, this looks like research. And this is not what we do. We do implementation. We provide services. We are not researchers. This is not for us. Well, they say, look, this is very complicated. These tools are fancy, and we don't have the capacity to use them. Or they say, look, these are not. We don't have the time. I'm so swamped in all the other activities that I really don't have time to do this. So we identified this problem or this issue, and we think that this is the next step for system thinking to continue getting traction in health systems. And we think that now is the time to bring all of those tools that are fantastic, that has been used in research settings primarily, and bring them to district managers, bring them to implementers, bring them to health professionals. And this is what Carmen will describe it in a minute. This is the initiative that we've been working for the past year, funded by the Alliance for Health Policies and System Research, and it's trying to adapt system thinking tools that are very useful to be used by district managers. So as in this session, we want to show you, we want to give you an overview and some lessons from what we have learned so far in the year and a half that we've been working in this project, in this initiative. And we have a fantastic group of experts in system thinking now that will be showing us, starting with Don de Savigny. He will describe some of the key concepts of system thinking and how they can be useful and at the district level. Don was one of the leads in one of the key documents on systems thinking for health systems, the red book that we call it, from WHO in 2009, and now he's working with us on translating that at the district level. And then we will have Carmen San from Swiss PPH. She will be describing the initiative, and she will be describing as well how COVID-19 affected the initiative and some of the positive unintended consequences of COVID-19 for our work, for the work that we are doing with the three countries, with Timor, Botswana, and Pakistan. After Carmen, we will hear from Sahim and Samsa how they are using process mapping to improve contact tracing strategies in Islamabad, in Pakistan. And after that, Antonio Bonito will describe and will share with us the journey that they are having in Timor-Leste to integrate system thinking in 2 of the districts of the country. Finally, from the country perspective, Tiamo Kiakabetse, he will show us how a very interesting way of using system thinking tools they have in Botswana. They have used many different tools to look at the same reality with different lenses. And he will show how business process mapping, causal loops, social network analysis, how they can be complemented to each other to get a better understanding of the system. And to wrap up everything and bring everything together to SysTech, Kwame from the Alliance for Health Policies and System Research, she will be launching SysTech for the first time in this session. and he will be inviting all of us to participate in this community of systems thinkers that we want to create. And we are almost part of it. All of us are part of it already, but we don't know yet. So without me, Daniel Cobos, and Helen Pritchard from SysTech, we will be moderating this session and making sure that everyone is on time and we achieve the goals that we are supposed to achieve for this session. So without further ado, I want to turn to Don de Savigny. He's professor on health systems and policies at the Swiss Tropical and Public Health Institute. He's one of the gurus of system thinking applied to health systems in the world. And he will share with us some concepts and rationale for using system thinking at the district level. So Don, over to you. If you can please share your slides. Hi, Don. We see your screen.
Okay, thanks, Daniel. And hello and good morning, good afternoon, good evening, wherever you are. I'm in Canada at the moment, and it's about just after 4 o'clock in the morning, so I hope I can remain coherent for the rest of this session. Daniel's given a nice introduction to the session. For me, this is particularly gratifying because I first got into systems thinking about 20 years ago when I was working in the Ministry of Health in Tanzania in the Health Systems Research Unit. And that's where I learned just how powerful systems thinking can be when we apply a systems-wide approach to all the building blocks in a health system to tip the system into a much higher level of performance in a very short time with very little resources. And ever since then, I've been really trying to promote systems thinking in everything that we've been doing, certainly in the research world. And so we've been, I think, fairly effective at that over the last 10 or more years at the national level, at international levels, and in the research community. And there's a lot of work going on, but really where the rubber hits the road is that in health is with districts and district health systems and district health managers. And if we think about it, the district health system is a microcosm of the health system. It is where everything, all the major building blocks of a health system exist in a district. It's where you have tertiary, secondary, primary health care facilities. Is where you have all the major elements of the health system in terms of human resources represented. It's the lowest level of the system where you often do budgets and planning and so on. It's usually the first level of aggregation or flow of health information, of the health management information system, etc. And it's often where street level policy is set and happening. And so bringing systems thinking down to the district health level is really a very important thing for us to see and learn how to do. And if we think about it, every system, including the health system, is perfectly constructed to do what it does. The problem is that we often don't like what is coming out of our systems, and I think the COVID pandemic experience is making that more vivid for many countries. And if we don't like what's happening in the system, we're not getting satisfaction in terms of the performance, you have to change the system, you have to fix the system. And this is where systems thinking is so powerful for us. But of course, these systems are really resistant to change. They make their own behavior. And often those who are managing the system, particularly in districts, are so busy are keeping all the balls in the air that they haven't time to learn or to change or to absorb new ways of doing things. And systems thinking is a new way of thinking and operating. And so, how do we find a way to help at the base of the pyramid apply systems thinking in a effective way? And the reason is that systems thinking is it's a way of thinking. It's a new discipline of how we operate in our day-to-day lives. And some of us are very good at this, and it sounds like from the poll that many of us on the call right now are already doing this. It would be interesting to see how many are systems managers at the district level, and how well that's working. And this is really what this session is about. But systems thinking lets us, helps us change the way we think to deal with the complexity of health systems and the communities in which we work. And that's really important because systems thinking is also a way of communicating, of seeing things differently, of making sense out of what's going on around us, and develop a shared understanding, which is really important for changing our behavior, but also behavior of the system. We have to operate against the complexity. We have to work with that complexity to realize any visions we have of any of performance in the health system. But also, it also allows us to really identify and test a lot of possible ideas, interventions, different ways of doing business, and to be aware of these unintended consequences and find the synergies and leverage in the work we do in order to tip the system into higher levels of performance. And there are a lot of components in systems thinking. And I'm just illustrating 3 or 4 here that I think are useful to bear in mind all the time. And one is, of course, is boundaries. And if we think about the health system as defined by WHO with its 6 building blocks, those building blocks are actually subsystems, the finance building block, the human resource building block, and so on. Those are subsystems which are part of the health system as scoped currently. But also the health system itself is nested in largest systems, the economic system, political system, the economic system of the country. And then with it, then people who are at the center of the system and the communities in which they live and work are also subsystems that we need to work with. And that means that we are dealing with interconnections. This connectivity of systems is really key to how health systems work. The networks, the feedback loops among the actors in the system, the power in the system, the relationships among them are really key to systems performance, and understanding how all that works, particularly the social networks analysis that can be applied at district level are really, really important, because this is where the influences operate. These leverage points that we can find, the non-linearity of the feedback loops, the things that drive the system and block the system from doing what it is, what we want to see happen, is playing out there. And systems thinking helps us deal with those. And also to recognize that there are different multiple perspectives of all the actors in the system, the worldviews, the mental models, the paradigms that we all operate. Everyone sees and operates in the system in a different way, and their knowledge systems and voices have to come to play in a managed way. And of course, these systems all have history. No 2 systems are alike. And because of path dependency, which is a health systems thinking component, sometimes you can't go backwards in your system. You have commitments that are bound into the system itself, and you have to navigate forward from there. So the point is that all these systems are what we call complex adaptive systems. They're changing constantly because they're nested. And our tendency has always been to do technical solutions, interventions in the system, intervening in finance, intervening in human resources, in informatics, et cetera, and in service delivery. And this is where, as Daniel mentioned, we are often frustrated that things that work well in randomized trials and other approaches to understand efficacy don't work well when we look at systems effectiveness. And because of this fact that we taken too much of a technical approach and not a systems approach. So we all know the way, in fact, particularly funding partners that deal with health systems is this linear inputs in the building blocks to produce the outputs of service delivery, which have the hopefully better outcomes of effective coverage, of systems effectiveness and responsiveness, and the ultimate impacts of improved health and better equity and so on. is the way we often are encouraged to approach our problems. And the problem with this is it's linear, and no system works this way. We can never be sure that the inputs are going to translate straight directly to the impacts that we want. And we really have to do a better way of understanding the system and how systems behave. And here's where we say that the system is not the sum of the parts, it's really the product of interaction among all of the subsystems, all of the parts of the system, and how it interacts with the broader systems around it. And often what happens in between these systems is really, really instructive. And we don't do a good job of intervening system-wide, of thinking synergistically about the kinds of things we can do and how they can reinforce each other. So we often just do a financing intervention or service delivery intervention, and not appreciating the unintended effects in the other building blocks, and how we can actually find the tipping points, the synergies, and work with them in a way that has a much more powerful effect in a shorter time frame. And so we need to shift our attention as systems thinkers, and we all try to do that, away from just the reductionist approach of looking at the parts, but looking at the whole, understanding relationships among and between the parts of the system, focusing on processes. And this, as we'll see today, a process mapping is an incredibly powerful way to understand what's actually going on end to end in the system, and to be able to manage the change in the system. Working with all the stakeholders in a much more effective way through social network analysis, or there are a lot of tools available for that now that can be applied at district level and have been, to help us navigate the challenges we face, helping us be more intuitive, helping us do more synthetic thinking, and non-linear thinking. So these are all skills that we need to inculcate when we are applying systems thinking now, particularly at the district level. So sort of summing this up, systems thinking is a discipline for looking at the whole system, and a framework for working with the interrelationships rather than the components, and looking for patterns of change. This is really important, understanding patterns of change rather than our static look at events, because often what we see are just the events, and we're surprised by the events. The emergent behavior of the system often catches us off guard. And again, COVID does this almost on a daily basis these days in pandemic responses. Because under the surface of these events are patterns and trends that we're not looking at as carefully as we should be, and could be foreshadowing the kinds of events that will come forward. And underpinning the patterns and trends are the structures of the system, the drivers of the system, which we see less clearly. And underpinning that are the mental models that we use and have that are operating, the policies and rules of the system. And working at this level, at these lower levels, is how we can change the system much more effectively to get this transformational change. We have much more leverage if we work throughout the whole system at all these levels, and not just reacting to the events that we see on the surface. And so we have to get better at understanding system patterns to predict the future of what's going to emerge in the system. And we have to get better at designing structure in the system and the rules of the system and policy of the system in order to avoid the kinds of blindsided, unintended effects and behaviors of the system. And so just to, final slide, remind us where we've been in the last 10 years. It's interesting that it was at the first HSR 2010 conference in Montreal that we distributed the systems thinking book, for the first one that really brought these concepts to the fore. And by the second conference in Beijing, we were able to show lots of strategies that are being applied in systems thinking in health. And a few years later in Cape Town, there was the release of real applications, the anthology of fantastic experiences at global and national level of applying systems thinking. And at the last HSR conference in Liverpool, we launched this book of methods for health systems thinking for the research community. And so I'm now really pleased that we're able in this HSR 2020 to start talking about building a community of systems thinkers and seeing how this all plays out at the district level. So I just want to thank you for the chance to give this extremely fast overview of systems thinking that I hope resonates with your own experiences. And just to leave on the note that the district level, which is what we're going to be talking about today, is really the microcosm of the health system. And we have a real chance to find out how well systems thinking can help us change the performance of health and health systems by working at the most important level of the system, the district. Thank you very much. And back to over to Carmen, I think it is, or to Daniel. I'll stop sharing.
Okay, thank you. Thank you, Don. Thank you very much. I cannot switch on my video. I'm not sure. Okay. Well, anyway, so thank you, Don, for the introduction, and of course, when Don present this in this way, you say, of course, I want to use system thinking, and I want to use system thinking at the district level or any level in my life. And now we will turn to Carmen to see how these concepts, how these tools can be adapted to the district health environment and to be used by district managers. So she will be introducing the initiative funded by the Alliance for Health Policies and System Research that we have at SysTech in collaboration with the group in Pakistan, Timor-Leste, and Botswana. So she will be introducing the initiative so that we can move then to the country presentation. So Carmen, please, over to you.
Great. Thanks a lot, Daniel. Let me put this in screen sharing mode. You should be able to see my slides, I hope. So thanks, Daniel, and thanks, Don, for this really fantastic overview of systems thinking. It's always a pleasure to listen to this. So I will be brief because the objective of today is actually to hear from currently the systems thinking experts who are implementing systems thinking in the districts and in the countries, how they are innovating and bringing all this so far still a little bit complex and theoretic concepts to the realities of district managers. So let me go to the next slide. So the initiative, as Daniel was mentioning, was created with the objective to understand how we could bridge this gap between the theory of systems thinking with the practical realities of district managers. To do this, the Alliance for Health Policy and Systems Research selected us at SysTech as the support center, and it also selected 3 very diverse countries to conduct this innovation. These countries were Botswana, Pakistan, and Timor-Leste, and they will be each one of our colleagues in the research institutions and also from one of the districts will be explaining you why they are so diverse and giving you a little bit more of context in each one of them. But let me tell you what was the original plan of this initiative. So idea back in the days before COVID, when life seemed more or less predictable, even with systems thinking, we know that's not the case, but the original plan was to work closely with the research institution, the national ministries of health, and 2 districts to bring these tools and approaches and adapt them for the districts. So we were going to work mainly from the technical support center with each one of the countries. However, we started this time a year ago in Dubai. We all met and we had all these great ideas and action plans. But of course, COVID came and it disrupted all those plans as well as our lives. So we had to adapt, and actually we had to apply the agility from systems thinking to adapt to the current situation. And even though it was very challenging, we also saw it as an opportunity to rethink together health systems and how we could strengthen and reshape things as they were being disrupted by COVID. So the current implementation strategy was built following the 3 blocks that you can see on the slides. So first, we built an online community of practice, and the idea was to create a platform in which we would exchange across countries and much more than was originally planned. The second block was the decentralized health systems analysis hub, and the idea was that we would conduct research for and with the districts to analyze and reflect on their daily challenges. And last was, as we've been mentioning, kind of bringing all these tools and adapting them for the realities of the district. So given the circumstances, it became very obvious that we had to start with the online community of practice. And I must say, we've been talking about unintended effects, and this was a really positive unintended effect of the situation. We weren't originally not so much planning to work across countries, and this really allowed us to build and work with the 3 research institutions, or 4, including us at SysTech. And actually, at the beginning, we were at the technical support center, kind of, we started some trainings, but very soon this became a peer-to-peer community in which we were learning from each other and sharing experiences and challenges as we were moving forward. So it has been a very enriching experience that we started off in June. And I must say, yesterday I joined the session on building, working in partnerships, and Lucy Gilson mentioned that, you know, the most important thing is that it's fun, and this has been really, really fun and enriching, even though it was only online. And many of our colleagues we've never met, but still it feels like we have a strong links by now. So there have been several products coming out, and one of this is the session we are all participating, but there was also a webinar that we conducted discussing the unintended consequences of COVID-19. And actually, we will share it in a minute in the chat if any one of you is interested in listening to that. So how did we adapt farther than this community of practice? So when the research institutions were able to start moving around and meeting people, they did a fantastic job engaging with the district health management teams, as well with the national ministries of health. They also built very strong relationships there, and actually they are now the ones leading in the countries the initiative. So they will explain you a little bit more how they did the different steps, but we started identifying a health system challenge, and it was really important that this was done together with the districts. So we didn't really come with an agenda. It was more like, what are the challenges you're experiencing? And as you will see, obviously COVID-19 became a quite big challenge at the moment. And then, having identified this challenge, we started then identifying research questions that would be useful for the district. So also a joint work there with the DHMTs, and selecting which tools would be useful for the challenges that had been identified, and how we could start adapting that. And when I talk about tools, Dawn already mentioned the book, the methods book. So many of these are kind of represented there. And these are kind of the tools that we're going to be using. So on one hand, we have reflective practice, causal loop diagrams, process mapping, but these are just a few examples. But there's much more, and there's much more hopefully coming. But enough said on our side. I think it is really important that we today hear of this innovation as it is going in the 3 countries. We would really appreciate, because I think by now in the poll it was 80% of you consider yourself systems thinkers, so that's really fantastic. If you have ideas, comments, suggestions as we move along, we would be really keen on hearing them. So please burn the discussion forum or Q&A, and if you want to reach out, please do so also afterwards. And thanks a lot, and back to you, Daniel. And Daniel, I cannot hear you. I guess you're still on mute. Now I can see you. And
yes, sorry about that. Yes, thank you, Carmen. Thank you, and thank you so much for the overview of the initiative. And I cannot agree more with you. I think one of the many things that are going on in countries are fantastic as part of this initiative. But one of the things that I feel as one of the big successes already is this creating this community of practice. And we are already a small family, and I really like every other week, or even every week, to meet with all of you and learn from all the all the community that we are creating, and this is part of what we want to do with SysTech as well, is to extend that community, to reach out to more people, to create a huge community that can support each other. So before we go to Pakistan to hear from how they are using process mapping to improve contact tracing strategy for COVID-19 in Islamabad, I would like to ask you to answer this question, and the question is a simple question. Have you ever used process mapping? The team in Islamabad, Samsia and Sahim, they will show us how process mapping has been used to improve contact tracing for COVID-19, and we would like to know whether you have used it in the past and whether you have experience and you have some thoughts about process mapping. So Carmen, I don't know if we have the results of the poll already.
Yes, so we have already 60 people answering. Mixed results. So 44% are saying yes, I have experience using process mapping. 57% has never used it. Okay, very good. So you will, for those of you that you haven't used it, so you will learn from Sansa Rizan. She's the director of Child Advocacy International in Pakistan, and also from Saeem Sia, he's the district health officer. He is the director of the district health office in Islamabad. So they will be presenting how they use process mapping to strengthen the contact tracing strategy for COVID-19 in Islamabad. So Sahim, over to you to share your presentation and your thoughts on this. Zaim, we can now hear you. Yes.
Very much. Thank you very much, Daniel. I just got connected much. I'm going to give you a brief about how the pandemic started. We had the first case and how the district health systems in Islamabad and the district administration evolved itself from no systems into like the systems in Islamabad. I had test, track and quarantine systems in Islamabad. With me, Dr. Shamsa will be presenting the processes map, giving you a brief of how Islamabad is divided into two different territories of the rural and the urban. District Health Office Islamabad has multiple functions, as you can see on the screen. The first case when it started, then into the 26th of February, we had multiple challenges of, the human resource, lack of human resource, the doctors, medical technicians, supply and demand problems with PPEs, personal protective equipments, and the infrastructure as the course of the time, how we in the district started, establishing the surveillance system. And then with the systems thinking, we sort of tried to mitigate all the risk factors and to enhance the efficiency of the entire system. We have been working with the systems thinking. So until now, if you look at the numbers, until now we have diagnosed almost 21,000 people in Islamabad, and our district health surveillance teams, 20 surveillance and 19 rapid response teams have been responding 24/7 in the entire territory. Until now, we have sampled 60,353 contacts of the positives of the suspects, and out of those, and otherwise 21,000 were positive, and 6,000 plus were sampled by the district health office. So it sees 28% of the total disease burden is contributed by the district health office and the surveillance system in Islamabad. We started from the ground zero. If you see like how we started from within the resources of training our own staff, given we had as I mentioned, the challenges that we faced in the form of human resource, supply and the infrastructure. And then we train our own teams, and we've sent on the field for the contact tracing, for sampling, for confidentiality, for all the relevant things that they have to perform on the field. This is the entire statistics of the country. If you look at the number of tests run, almost 12% of the entire country's tests were run in the federal capital, and that's been pretty impressive job done by the teams here. On a given day, how we go out there to the fields to do contact tracing on the daily basis, if you see 255 cases were reported yesterday. And of those, 80 were diagnosed by the district health office, which makes it around like 30 to 35% of the total positivity. And then we do the contact tracing against 255. And then this is how we collect samples, how we isolate 255 by giving them, education and awareness about counseling or the, isolation, how to conduct the isolation and how to remain safe. Okay, so this is the entire system that tells us how laboratories of the private and the government and the tertiary care hospitals and the facilities and both private and the government and the district health office send all the positive cases or the samples to the National Institute of Health. And from them, we receive the line list of positive cases to the district health office, and we respond to them on the multiple levels. In the form of the rapid response, patient transfers from the hospital to the health facility, or health facility to the homes, or homes to the health facilities based on the clinical symptoms, interprovincial movement of positive patients, and then taking them to the relevant areas, auxiliary services like disinfection and the burial services. Now, the COVID surveillance cell basically performs multiple functions, checking on the recovery status of the infected people, mapping of the hotspots and the lockdowns, and we suggest lockdowns based on the number of positives coming in. The line list corroboration and the information for the chain of infection to break the chain, where we find the positive and the chain and how we have to intervene during that time. The patient follow-up is also done from the surveillance offices, and also the data segregation and the area-wise distributions for further interpretation or evidence-based decision-making. The contact tracing has been one of the strongholds of this office, and we conduct the testing of the family and the neighbors of the in the neighborhood. We do the risk communication, we do the random sampling, and that's how we send all the samples to the National Institute of Health for further interpretation. Now look at this is the community surveillance system, where the lady health workers have been a backbone of community surveillance, where they know who has symptoms, who is a contact of a positive person, who has any sort of like suspicion. They report it to us, and then that is sent to the surveillance teams for the contact tracing. We've been sampling from the hospitals, from the community, from mini markets, from the malls, from streets, and everywhere to make sure that no hotspots are built and that will have spread. We have contained it until now. So I'll now ask Dr. Shamsar Rizwan to further about the systems thinking from here onward. Thank you very much.
Dr. Sain, yeah, you need to stop sharing. Yeah.
Okay, so can you see my screen?
Not yet, Samsha.
Okay, so I've shared the screen. Yeah, can you see it now?
Now, yes.
Okay, thank you very much, Zain. So I must start by saying that there is a strong coordination and leadership role of the District Health Department at Islamabad, where surveillance teams were at the center of case management and contact tracing, and they were also evolving with the pandemic. A systems thinking lens actually helped us acquire a broader and systematic understanding of this very complex, interconnected, multi-stakeholder setting where processes are non-linear. The aim was not just to analyze, but to synthesize and identify leverage points that could be addressed for a constructive change. So we used two of the system thinking tools. One was reflective exercise or practice that helped us engage and that helped us build a rapport with the district health team. During the exercise, the team was able to recollect the COVID situation. They could express their feelings and emotions. They could identify how and why things happened and gave their critical views about how things should be done differently. As a result of this exercise, a process map was developed with the team. Collectively, we identified and mapped various elements, their connectedness and relationships and boundaries. So if you look at this map, now this is now the stakeholder mapping that we did. we realized after this that the surveillance team integrated information flows coming from various teams, from the health facilities, both public and private, from the community through the lady health workers. They would get lab results from the National Institute of Health. The rapid response teams would also go to the airports to, get the results from the airports as well. So all of this was happening. So we tried to map it on a process map. And if you look at this process map, you will see this is each stakeholder that is involved in the contact tracing is represented by a different color. And note that the arrows show the connectedness of these stakeholders and the relationship between these various stakeholders. So I'll give you another view. So this helped us to identify the key milestones that were there. So the first milestone was identification of suspected and confirmed cases. The second was case management, which of course involved not only home isolation, quarantine, but also follow-up of the cases. And of course, the main activity that we were focusing on was the contact tracing. So color coding of the map easily organizes these milestones as well. And you can see that the green ones are the identification part, and the case management is given in blue, and contact tracing is given in the red. I'll zoom in a little bit in this slide to show you how one stakeholder map point looks like. So if you can see here, the surveillance team is getting information from another stakeholder, and whenever there is a positive case, the team reaches the house of that person and then starts the contact tracing activities, which includes the risk communication and also taking the samples and filling the form and sending both to the National Institute of Health. And from there, some of the community teams are also informed about this, and this is how the cycle goes on. This is just an example of how the map really helps us to organize things. Now, there were many great things about using this map, and we had an opportunity. I think the biggest was the ability to visualize the system as a whole. And also because it brought the team from the field and from the management sitting together, being involved in the whole process. This built the team morale and involvement and helped us identify certain bottlenecks and pain points that were there in the system that could be helped. There were also opportunities for process-driven digitalization as opposed to technology-driven digitalization, and that helped us improve the efficiency of the system. Also, it really is useful to monitor the performance of the entire process. And then we could easily define red zones where you can put in your limited financial resources. So this is, but of course, like in any system, there are always challenges. And one of the main challenge is that it is a very resource intensive activity. An element of fatigue can come. And as you know, that the district teams are already working at so many levels, and then with COVID, the situation is even getting worse. And with the second wave coming, they're very busy. So to engage them was also another one of the challenges. But once they have now realized the value of the whole thing, it is getting much better. And also the use of multiple technologies, paper and digital and mobile, all of these technologies. So really have to work on that. And sometimes, the processes are also not very efficient. So we are still working with the team, and I really thank the district health team with whom we are currently working to tackle these challenges with a hope that we will win this war against COVID. Thank you very much.
Thank you, Samsha. Thank you, Saim, very much for sharing this presentation and really fantastic way to show how system thinking tools like process mapping can be used and can be applied to an emergency. Because we usually think that system thinking and these type of tools are research tools that we need 1 year, 2 years to implement. No, in Islamabad, it took a couple of weeks to start working with process mapping on contact tracing strategy in Islamabad, and it will continue. So it's an example of how we can use system thinking tools to adapt. Now we are moving to Antonio Bonito from Timor, and I've been told that Antonio, you are with the district teams in the room. So just hello to all the districts and the district health management teams that you have with you, and they are supporting you. So please, Antonio, go ahead and share with us the journey in Timor-Leste to apply system thinking at the district level. Over to you, Antonio. We cannot hear you, Antonio. Maybe you are on mute. Antonio, we can't hear you. We can see the slides, but we cannot hear you. Antonio, yeah, try to unmute yourself. Oh, there is something wrong with your microphone. Yeah, okay, so let's jump a little bit and while we fix the technical problems with Antonio in Timor-Leste, we will move to Botswana. Antonio, can you please stop sharing the screen and we will try to fix the problem? No worries. You will have the opportunity to do the presentation. So now I would like to move to Botswana with Tiamo Kabetse, where the team in IDM in Botswana have used many different system thinking tools to look at the reality in the district systems, and they've managed to bring all this information together in a meaningful way, and they are now in the process of unpacking this with the districts to move forward. So Tiamo, over to you in Botswana. Yep, we can see the slides and hopefully we can hear you.
Okay, I was waiting for you to let me know that you can see the slides. Thank you so much for having me. I was sharing the slides. I don't know what happened just now.
Yeah, you were sharing the slides and now you are not. Try to share them again, please.
Yeah, let me just do that quickly.
Yeah, if you
can see them.
Yeah, put them in the slideshow, please. Yes, very good. We can hear you and we can see the slides. Yes, go ahead.
Oh, okay.
Yeah.
Thank you so much, Daniel, for having me. Good morning, good afternoon, good everyone, wherever you are participating on this forum from. My name's Tiamo Kabetse, and I'll be presenting on behalf of the Botswana team. And the Botswana team comprises of the Research Institute and the two district health teams that we are working with. So our presentation is basically going to share our experience on use of systems thinking approach and systems thinking tools to understand and improve processes at district health management team levels. And this is the outline of our presentation. We'll basically be sharing the context of the health system in Botswana in terms of how we've been going through transformations. And we will look at how the project used social network analysis to understand the complexity of the DHMTs and the interactions of actors, and the use of SWOT analysis to appreciate the challenges that our different DHMTs are facing in terms of transforming from a centralized to a decentralized system, and also use that opportunity to see how we can be able to adopt systems thinking as an approach within our DHMTs. Based on the SWOT analysis, we would look at the use of Eisenhower matrix to appreciate or to prioritize our challenges, and then use the fishbone to look at the root cause analysis of the identified challenge. And then the next steps would be the use of business process mapping tools to try to now address the challenges, coming up with interventions, and then the use of causal loop diagrams to sustain systems thinking within the DHMTs. So basically, as I was saying, the Botswana, just a minute, sorry about that. Botswana health system has been going through a transformative process whereby we are trying to restructure from a centralized to a more decentralized system. And as it is typical of complex adaptive systems, the initially conceptualized a transformation has experienced a lot of unintended consequences, including resistance by actors, limited resourcing and capacities, as well as conflicts of interest. Moreover, we have been able to find that individuals within our district health systems are still thinking within that compartmentalized mentality or silo spaces, which is devoid of comprehensive systems lens. And based on this understanding, our project was basically to was anchored primarily on applying systems thinking approach to the district health management team to change their mindset on the transformative process, as well as identifying opportunities to address the systems thinking challenges, because we understand that for us to be able to bring about that change, systems are generally require shifts in perceptions or social network configurations for them to be able to embrace change. And given that health system environment is quite volatile, uncertain, complex, and ambiguous, we had an experience whereby we had an outbreak of COVID-19. And with the outbreak, the system was now forced from performing from a planned transformation, which occurred at a larger scale than the local access focus or perceived approach of decentralization. So we needed to be speedy in terms of our transformative process, and also ensure that we support the system to be resilient. So the question that we could be asking ourselves now is whether the pandemic, COVID-19, should we see it as an opportunity that was going to help us to strengthen our health systems, and whether can we use systems thinking for district health systems to provide solutions to the pandemic? And I must say the response to that will be based mainly on our ability to seize the moment and create value proposition for systems thinking approach through the project's outcomes. We'll further have this discussion in our plenary later. And how did the Botswana team use the systems thinking tools to support the DHMTs? We have adopted a multi-tool approach to implement systems thinking. And one of the things that we appreciate is that there is need for alignment and contextualization of the tools in responding to the emerging issues. And the process requires both a prospective and retrospective learning and adjustment as we are continually implementing. So as part of our project entry, we used the social network analysis together with the district health management team. And at this level, we were just attempting to fully understand at a very superficial level health governance based on the building blocks of the health systems, and also applying Liebel's conceptual framework on characteristics of good governance. And the informal application of social network analysis basically focused on the first two stages of the framework, which are how do we understand the structure of the DHMT in terms of functioning and operations, and also looking at the different stakeholders. How do the interconnectedness of the actors influence the ability of the health systems to function? So this social network analysis, as I said, was also interlinked to the building blocks of the health system. With understanding of the health system structure.
Just to mention, I'm conscious of time, so we have like 2 more minutes for this presentation, just for you to know.
Oh, okay. Let me just rush through them. We also applied the causal SWOT analysis to try to appreciate the strengths and opportunities, and we used this opportunity to juxtapose weaknesses and threats to identify potential solutions and leverage points using the SWOT analysis. And after applying the SWOT analysis, we were able to brainstorm and prioritize the challenges that the district management teams were facing. And we used the Eisenhower prioritization matrix to look at what is more urgent, because we understood that we cannot be able to address all the challenges at a go. So following identification or prioritization of the challenge, we then used the root cause analysis tool to appreciate some of the root causes, both at category and subcategory level. And the tool was found to be really helpful because we were able to really use tacit knowledge by the implementers regarding some of the processes, the prevailing issues, and their attributable causes. And these are some of the issues that emerged from the root cause analysis. We were able to identify poor work ethic, communication channels, and as some of the causes that were hindering transformation in the DHMTs. And one of the things that we appreciated about the process is that we are able to also see emerging themes, as you can see the color codes. So this gives us an opportunity to be able to address some of these emerging causes in a seamless manner. One of the tools that we are also applying is the reflective practice, which is embedded as part of the approaches to implement systems thinking initiative at DHMT. We are also, as the research institute, using that approach to reflect on how we are doing to support the DHMTs. And basically what we do, apply that taxonomy of reflection, looking at what is it that we are able to remember once we have engaged with the DHMTs and across the cascade up to creating interventions with the DHMTs. I think in the interest of time, the next steps, we are looking forward to using the business process mapping to try to now apply.
Tiamo, it seems that the audience is enjoying very much, so no worries. you can take your time.
Yeah, okay. Our next steps, we are looking at now applying the business process mapping in terms of improving the processes at DHMT level, and also using the theory of change to now work with the DHMTs to apply the interventions. One of the tools that we are also looking forward to using is the causal loop diagram to basically analyze and visualize the interactions and relationships of different system elements in terms of how can we reinforce systems thinking and also identify those elements that are going to be balancing the system in terms of applying systems thinking. Some of the learning points from our experience and with as the Botswana team, systems thinking is quite vital in understanding complex and highly interactive and unpredictable health system dynamics. And there is need for adoption of multiple tools and approaches in applying systems thinking at DHMTs. And also participatory approaches and learning by doing is quite useful in mindset shift. And documentation of processes, including unintended consequences, is crucial in systems thinking for district health management team. In the interest of time, let me conclude by Einstein's quote that we cannot solve our current problems with the same thinking we used when we created them. That's why we now have to change our mindset and apply systems thinking to be able to change the issues that we face as health systems currently. Thank you so much.
Thank you so much, Tiamo, and thank you to the team in Botswana. The IDM team is a fantastic group of very, it's on my video, fantastic group of researchers and implementers, and they have vast experience in the use of system thinking and in health system strengthening approaches in Botswana and outside of Botswana as well. So thank you so much for the presentation, and thank you so much for the different approach that you have used in Botswana, in the sense that of bringing different tools to look at the reality from different angles. So now I think we still have the problems or the issues with Antonio's microphone, but we have Antonio Bonito. He works at the World Health, the WHO country office in Timor-Leste, and we recorded this session because usually the internet connection in Timor is not very good. So we recorded his presentation just in case, and we are going to use it as the backup. For this, it's not the same as
good morning,
Antonio.
Good afternoon, everyone.
Can you?
My name is Antonio Bonito.
Okay, just to say that we will see the presentation right now.
Timor-Leste. Today, I want to present you about the journey of system thinking in Timor-Leste. Timor-Leste is one small country in the Southeast Asia, gaining independence in 2002. The total population is 1.2 million inhabitants. The most 70% of the population living in rural areas, and majority of the population is Catholic. I would like also present you about the health system delivery in Timor-Leste. This is that we have 7 steps of the health delivery system in Timor-Leste. First is we call in SysTech, Integrated Community Health Center, and then we go to health posts, and in sub-district level we have a community health center, and in district level we have also have a community health center, and also in district level we have a hospital, and we also have a regional hospital and national hospital. And also I would like to tell you about the journey of health system in Timor-Leste. The system thinking was introduced in November in Dubai. After that, Timor-Leste prepared a comprehensive action plan to introduce this initiative in March 2020 for a period of 2 years. However, because of the COVID pandemic, the action plan could not be implemented because of the several travel restriction and preoccupation of the national and district officials. So we cannot implement. But now we start to implement in system thinking in Timor-Leste. How system, now I would like to also inform you about the system thinking coordination in Timor-Leste. First, we introduced to the Honorable Minister
I'm not sure what is going on. I think we have problems also with the recording, which is unfortunate and weird. But maybe while we try to fix these technical problems, maybe we can go the questions and answers, because there's already a number of questions and on the both discussion forum and Q&A. So Helen, if you're there, please, can we stop sharing this presentation now? Yeah. So Helen, please, over to you to facilitate the questions and answers session on your side. Over to you.
Hello, yes, hi everybody, and thanks so much for all the presenters so far. Sorry about these technical issues that we're having, and really just to say it's an honor with all these speakers and participants. I see really a huge wealth of experience here. There's a lot going on in the discussion platform. Certainly, I think an echo for the complexity of systems, how this is needed now more than ever, and really how critical this interaction is between district managers and researchers. I think, Soraya, you're mentioning examples from Cape Town, and I'm sure there's many others as well. I would like now to take a first question from those that have come in, from Marsha. It's about this whole question of getting started with systems thinking at the district level. I'm going to pass this question to you, Shamsha, please.
Yeah. Sorry, could you repeat the question? Sorry.
There is a question from Marsha in the Q&A, wondering just how to say a little bit more about getting started at the district level in the building understanding around systems thinking and use of some of these tools.
Yeah, I think the most important thing is to really build that rapport and engage with the district health people. So that is the most important step. And when we start in the district health systems, I found the reflective practice to be a very important tool that helped us really engage with the team. And since the whole team is talking and contributing, that really created that rapport. So I think that was the first thing that needs to be done to connect.
Thank you very much, Shamsha. I come now to a next question. I'm going to combine a little bit a few questions.
Helen, sorry if I can just quickly interrupt you. Could we turn on the videos and leave them on for all the speakers? So that would be Zaim, Tiamo, Don, Shamsa, and Antonio. I don't know if your connection allows that, but it would be great to see all of you. Yes, I think it would be much easier to moderate and also, yeah, for the audience to see all of you. Great, thanks.
Thanks, Carmen. So there is questions coming in now from Anisha. I mean, how in depth to go when we are thinking of systems or the subsystems and wanting to design or redesign and test some of these systems thinking tools with interventions, and as well how to monitor progress in systems thinking. Tiamo, I was going to look to you first for that, if that's okay.
Okay. Thank you very much. If I understand the question is how do you go in depth in terms of designing and also testing interventions and using systems tools and how to monitor progress? I would indicate that in terms of probably testing interventions and also monitoring progress, we are yet to appreciate how things will pan out in the due course, because this is a continuing process. But one of the things that I can indicate in terms of at least designing and working with DHMTs, one of the things that has worked really well for us is the initial building rapport with the DHMTs in terms of understanding that we are coming to work with them to ease their work, to also support them, because we all are aimed at bringing about better outcomes for our health system. So appreciating and working with the DHMTs and using their tacit knowledge to be able to identify elements where the systems thinking can be anchored on. So in terms of design, we are learning together with the DHMTs, and we need to be able to do that as system thinkers, to learn from each other and appreciate that they have knowledge. They may not have good packages of ensuring that we implement that knowledge, but otherwise we learn together. And I think in terms of monitoring also, we indicated that we need to have apply the process of reflective practice, because through that, and also ensure that DHMTs operationalize the reflective practice as part of their routine work. In that way, they are able to monitor progress in terms of how the system is responding to some of the initiatives.
Thanks very much for that. And maybe just one follow-up question to you while you're on this from the audience. There was a question about the timeline, how long it might take you to be introducing and using some of these tools. If you could say something on that.
We are looking forward to, and like I said, this is an unfolding process, and there's a lot of back and forth. But our timelines, we are looking at about for the next 2 to 3 months that we will be able to say now this is good application and testing of the tools. But we can never really commit to a particular timeline. We would look back at this at the process and say we have been able to do well here. But because of the back and forth, it's really difficult with systems thinking to conclude on or commit on timelines.
Okay, thanks very much for that.
Yeah.
There is a few more questions now in. Let me bring the next one. The next one is, I guess, yes, there's been a lot of talk indirectly about COVID and the effect on systems thinking. Maybe I can pass this question to Zaim. There's a question in the chat about whether we should see COVID-19 as a threat or as an opportunity. Would you be able to briefly say something there?
Thank you, Helen. Of course, it's a threat as well as a challenge, because if we see how the health systems in the entire globe has been shaken by the COVID challenge, and we've been trying to understand its dynamics and how we can control the COVID-19 by enhancing the health systems and surveillance systems. And earlier is of course a threat, and the later is an opportunity for us to strengthen the health systems through the different modalities.
Thank you very much for that. I'm seeing a few questions now about funding and how these activities were funded at the district level, or if they were somehow embedded in routine activities. I don't know, Zaim or Shamsia or Antonio, would someone like to come back on that?
Yeah, as far as the embedding is concerned, of course, embedding would take some time. So we have just started with the district teams, and district teams are now understanding the things, and they are, getting used to it. But the embedding itself, I think, would take a little more time because they are very busy right now, and getting that time off and really sitting and thinking and making all that progress, it will take a little time.
Thank you very much for that, Shamsia. So I'm quickly looking through, Carmen. I don't know if you can help me also if there is more questions now in the chat. I think there is one also from Tolip, and this was more about the capacity building and the support that's being provided in the countries. I don't know, maybe Don, you would like to say something about that?
Well, I think we're going to have a good conversation about that when we come to building this community of practice. I think this is probably the main element that is the sort of peer-to-peer support for systems thinking at the district level is coming through this community of practice of sharing experiences, sharing the use of tools, the kinds of dialogue that goes on amongst everyone from, and also particularly the national to district relationship is fostered here. And I think going back to that other question about in building back better the effect of COVID on health systems in the future, I think we should be optimistic. I think there's going to be massive opportunity for change. We're going to see a lot more multilateral support from the world. We're already seeing the Sustainable Development Goals talking about a much more systems-wide approach, systems thinking to bring to bear on universal health coverage and sustainable development goals. I think we're going to see so many changes in terms of health and social protection systems that we need to be ready for this, but we need to be ready to bring it right down to the ground. And this is why I think this district level focus today is really important. And the faster we can support skills, the skills sharing that is happening for system-wide thinking for district health systems, is going to be really important in enabling that future that is going to come. I think we're going to see a lot different, a very different character of resources that will become available for health and social protection systems in the foreseeable future that probably wasn't going to happen without the pandemic.
Thank you very much, Don. There is a few questions quite specifically interested in the situation in Timor, and if you're already seeing some effects from the use of these tools, able to track their use. Antonio, are you able to come in on that? We still have this problem.
Antonio, I don't know if you have any headphones that you could borrow. I think if anyone in the room has headphones that you could borrow, we could try that. Because at the moment we cannot hear you. Hi, Francisco.
I make now the question a bit broader, so we maybe can come back to the interest in Timor. So there is a few questions about how to kind of track that these tools are taken up, that they are used, that we start to see them having an effect.
Oh, we can hear Antonio.
Okay, hello.
We are agile. Antonio, please go ahead. There is quite some interest about the effect of these systems thinking tools in East Timor.
Okay, I would like to brief you about the process of initiative in Timor-Leste, because our presentation cannot be presented yet. We are now in steps of identify the system challenge now in both districts, Bikeke and Dili. Because we just start 2 months, so it is not going so fast because of the capacity of the coordinator and capacity of the district health management team is to understand the process. So we are still moving slowly, but now we are in the identify the system challenge. Most of the in Dili there are 3 identify system challenge. In one in human resources, and another one is in health, quality of health information system, and the planning and budgeting. So, and in BKK we still need to identify the system challenge is still in the progress. We already conduct the orientation in BKK, but the final identification is still in progress for the finalization. So this month we will rediscuss again about the challenge and how to find the root causes analysis about this challenge. So this is the brief of Timor-Leste at the moment.
Thank you very much, Antonio. That's great that you're able to give us that update now. I see a question now coming in from Sarah Browser. This is asking about recommendations for systems thinking at district level in situations where the national system is still working in silos and the devolution or decentralization process is not effective. Is there someone that might want to speak to that? Shamsha, may I look at you? I know you face a bit this challenge in Pakistan, or to Don more generally.
So I think with a decentralized system, it is important to engage with the district teams directly. And once the district team sees the value of it, so once you start rolling the whole thing and they see, if there is an advantage, that is where the system takes it up. So I think in Pakistan, national ministry is also very much supportive of this initiative. But then at the district, it is important at the provincial level as well. So we are working in 2 provinces for this particular initiative, and the other province we have involved the provincial government. So I think it's important to involve those people so that you can have the initiative being a success.
Thank you very much. Anyone else want to come in on that?
Yeah.
Go ahead, please.
All right, Helen. I think one of the issues as well that we need to appreciate as different systems thinkers is the fact that generally district health teams are willing to change, but they don't have that idea of how to change. So once, like Shamsa was saying, once you create value proposition for systems thinking and create that mindset within themselves to appreciate that once they adopt systems thinking, they would actually be able to minimize workload or achieve their outcomes even more, they are likely to adopt systems thinking. So I think what is important as well is to also contextualize it to the level of the DHMTs and bring it as a way of supporting them, not as an additional workload for them.
Great, thank you very much for that. There's also from Ismail a question now about, given all systems are so different, if we have learning going on in different systems, do we see ways that this can be brought together for cross-system, cross-country learning? Any of our panelists want to say something about that? I think we are living this experience now.
Okay, so if you look at how like systems thinking with Dr. Shamsa and us in the district health and all the stakeholders coming together, I think it needs some sort of like leadership to engage different stakeholders to make sure that there is a system in place. While system earlier might be working in silos, but how like one of the systems would take lead in the entire process, say COVID-19, and how we built some of the surveillance systems in Islamabad, and we had to connect with different stakeholders at the same time. They have different domains. So I think it is pretty much possible and easier if you're committed to work and also that you're working in the greater interest to save people. It is pretty much possible.
Thank you very much for that addition. I think there was another question about experience of using SNA, that it can be difficult to make sense of in practice, especially when it's complex collaborations. Is there anyone able to speak to this now amongst our panelists? Don?
Maybe I can chime in here. I think the first thing before the social network analysis is the stakeholder mapping. And in almost every instance where this is applied, there are surprises because people realize in their silos that, oh, we didn't know that these guys were really interested or doing that. And we need to be connected. And then the social network analysis lets you understand a little bit more to get away from the hierarchical understanding of how things are happening into this more networked way of doing that. And then leading in then to the process mapping and getting everyone's processes on the same page with the different stakeholders having their own lanes, if you like, but seeing the crossovers. And we know that health systems are pretty complex, but we've been applying this in civil registration and vital statistics, which is a domain that actually requires 5 ministries to work together: Ministry of Justice, Ministry of Interior, Ministry of Local Government, Ministry of Health, and so on. And you can imagine how much extra layer of complexity that is. And just doing that, getting people to realize that to see the whole show as a whole, end to end, and realize everyone's role in it was hugely powerful in bringing people together, even though everybody was in their silos. But suddenly they started seeing the connectivity that was possible and started finding solutions that they never would have thought of independently. So I think just the act of applying these tools can be really, really illuminating and start bringing people together, even though there is a centralized system or it's not clear who's really in charge all the way down to the ground level. So I think what has been so shocking and surprising to us is how powerful these tools are in making people realize the system as a whole and thinking differently about tackling their day-to-day work.
Thank you very much, Don, for that. We're coming to the end of this session. I still see there's a lot of questions coming in about COVID, how we can use systems thinking tools, also seeing now the crowding out of essential health services that we are seeing is ongoing. Maybe I let all the panelists say a final word on how they see this. I would start with you, Tiamo, if that's okay.
Oh, okay. No, thank you very much. I think from the Botswana experience, we really appreciate the learning that we are getting through systems thinking and implementation. And when we started, we also had a lot of unexpected consequences, if I may call it that. But now we are learning a lot from the process. And also we are appreciating that, you know, for us to be able to make a difference, we can only make a difference through the people at the DHMT. We don't have all the answers, and we just have to work together to be able to drive this. And at the end of it all, we believe that if implemented well, systems thinking would be the way to go, even to now counter some of the risks or the threats that we saw through our analysis, being COVID-19 and other pandemics. So we are looking forward to the full experience of this, especially now documenting through the research process.
Thank you very much, Tiamo, for this. And before we move to the presentation from the Alliance, I think one last word on how systems thinking can help in this whole crisis with COVID, Shamsha.
Yeah, I think we've given an example with how in the COVID situation, we have been able to use the process map and look at the contact tracing from a holistic and systematic way. So I think with COVID-19, there are many tools that one can utilize with the district health teams, and that depends actually on the simplicity of the tools and the ease of the tools and the fact that the district health team's decision to which tool do they want to really adopt and which do they think is really going to help them with a particular problem. And that's how we were able to, the reflective practice really helped us also understand that which tool would be best utilized for this particular problem that they were talking about. And I think as we go on, we might be able to use more when we see certain challenges within the system. So that's how I think it's an evolving thing as we go.
Thank you very much, Shamsha. Maybe a last one now. Sorry, go ahead, Don.
Can I add a thought on that? Because I think that crowding out of essential health services is really a critical issue in this response to the pandemic. And I think, again, this is where systems thinking is important, because now we're talking about boundary issues. And I think countries which have done a better job on this is where they've looked at the health system and social protection systems together with sort of all of government, all ministries' approaches, and have been able to bring some balance. I think this is particularly true in Africa, that they've been doing this, and systems thinking can help deal with that, with these when we look at what I was saying about determining what are the boundaries, what's the scope of the challenge that we're facing. And here we have to step out of the traditional sort of health system and healthcare system mentality and bring in many more actors in the discussions. So systems thinking helps us there.
Thank you very much. Thank you, Don. A last word from Antonio before we move on after the Q&A for the next session.
Thank you again. I forget to explain how we identify the challenges. So we only use the SWOT analysis for the 6 building blocks. to identify the system challenge. We conduct this for the 2 districts, the same process and the same tools, but again, because of the limitation and the capacity of the district health management team, experience about this process also make challenge for the process itself. So in the next step, the support, technical support is very important to moving forward this initiative in Timor-Leste. Thank you.
Thank you, Antonio. I'm not sure if Zaim is still there, just for a final word on the COVID crowding out of essential services. I think also some issues with
yeah, I'm here, and I think since we have been running short of a lot of human resource, and the outpatient departments have been closed for a while, and it has created a lot of problems in the provision of the healthcare. But since we now are coming back on the track and learning to live with the COVID-19, and we are trying as a part of the health system that we can assess our opportunities and challenges at the same time, coming out with a system that can actually provide services given the threat of the COVID-19. And this is how we have to live in future as well. Thank you.
Thank you very much. I would like at this moment really to thank all of the panelists, and really as well all of you that were raising questions in the chat. I'm sorry, we didn't manage to actually interact too much on the chat, but we were trying to field these as much as possible to the panelists. I pass the word back now to Daniel to introduce the next speaker.
Thank you everyone for this fantastic discussion, and thank you for all the participants in the session for the interesting questions, and feel free to reach out to us to follow up with questions or comments or ideas. We would be more than happy to engage with you. And now we are gonna move ahead with the session, and now it's coming one part of the session for which we are very excited about is the launch of SysTech, the launch of the System Thinking Accelerator. And Aku Kwame from the Alliance for Health Policies and System Research will be describing and presenting a little bit what SysTech is and how we all can engage with that platform. So Aku, over to you.
Great, thank you very much, Daniel. Good morning, good afternoon, good evening, everyone. It's wonderful to be here. I want to thank the presenters, not just for their great presentations, but the country teams for the really inspiring work that they've been doing over these months in difficult circumstances, and what they have shared with us today. So I have a very easy task this morning, and I've looked at the participant list. I see a lot of friends, I see a lot of teachers and a lot of mentors, and so this is really a pleasure to do. We at the Alliance have been really thrilled to support this work in systems thinking, and really getting back to expanding our portfolio on systems thinking, looking at applications of systems thinking, particularly in LMIC settings. And of course, Dawn gave us a beautiful overview of what systems thinking has looked like in the past 10 years, from the launch of the Alliance flagship report in 2009 to the 2 supplements that were published in 2012 and 2014, and then the handbook that Dawn worked on with colleagues Carl Blanchette and Tagreed Adam, really moving us from applying concepts of systems thinking to strengthen health systems, to capturing examples, to looking at frameworks, to building tools and methods. And so in today's session, we've looked at what this looks like in 3 countries. Carmen and Daniel have spoken about how they've been working across these 3 countries and have really built this peer-to-peer support and learning for applying systems thinking, not only tools, but also philosophies and approaches. And so today we want to just introduce to you this notion of a systems thinking accelerator. And so the first question would be, why do we need a systems thinking accelerator? And so, as has been said, we appreciate the fact that many of you are already doing systems thinking. You've been doing it for a long time. And so this is a way of building globally on the efforts of applying systems thinking, on looking at definitions of what systems thinking means. We've had a lot of I would say mild confusion when we say systems thinking. What does it really mean? Are we speaking about a systems approach that relates to the health system building blocks? Are we speaking about the actual tools, that some of them that were mentioned this morning? So how do we define the field of systems thinking, and how do we appreciate the work that is ongoing, that has been done, and that we want to do in the future? But of course, within this, we recognize the fact that there's still great scope to apply systems thinking when we actually begin to look for places where systems thinking is being done. Very difficult to find those examples. Either they are being done and not being called systems thinking, or we're not documenting them. So how do we build the knowledge that we have? How do we share experiences? How do we adapt tools like we heard in the presentations today? How do we join up and work together across various settings? So we thought that there should be a way for us to capture and bring together the distinct and various works around systems thinking. And so that's precisely what this accelerator seeks to do. And so SysTech, as we're calling it, basically has three main objectives that we are looking at. The first is to be a platform for strengthening systems thinking science and practice. And so this speaks to the issues of defining the field, as I mentioned, and then also giving us opportunities to exchange experiences and to learn from one another. SysTech also seeks to be a community of practice that is engaged in these questions, engaged in using and refining and adapting these tools and these methods. And so it's an opportunity for us to convene the critical mass of systems thinkers globally, but also look at different aspects of capacity strengthening and thinking about what that looks like, what kinds of capacities are required to really push forward the field of systems thinking. And then thirdly, to be an amplifier of applications of systems thinking, particularly in LMICs. So promoting and advocating for the use of systems thinking, not only in research, but in practice and in policy making, and also to be able to capture, as I said, those settings and those examples where people are already doing systems thinking, but perhaps not calling it that. So what are going to be the phases of the systems thinking accelerator? We're going to start, first of all, by developing a catalog, and we want to be able to capture who are the systems thinkers. So in the earlier poll, 80% of you said that you consider yourselves to be systems thinkers. We want to know who you are. We want to know where you're based. We want to know what you're doing. We want to know what you want to learn about systems thinking, but importantly, we want to know what you want to impart, what you want to teach, what you want to support in systems thinking. And we also want to hear from you about your expectations for a community and what you expect and what you want in a community. So that would be the first step, is actually building this catalog of global systems thinkers in health policy and systems research. The second phase will be a co-design phase. So once we've gathered all the data that you'll give us, we will invite you all who are interested in co-designing this community. So actually fine-tuning its modalities and how we would work together over the coming years. Where would we focus? What would be important? How would we support not only capacities, but also the generation of knowledge and the translation of systems thinking approaches in our settings? And then once we've designed the community, then we would actually launch it. So today is a soft launch, but we would launch it in its fullness once it's been co-designed by all of us together. And we see this happening over the next 6 to 12 months as a process. And this fits into this broader work that has been presented to us this morning on the COVID-19 Observatory, work that's being led by the colleagues from Swiss TPH and the country teams in Timor-Leste, Botswana, and Pakistan, and then building on really the great work that's happening within the districts in those countries. And so how do you get involved in SysTech? We are launching a survey, so there should be a link dropping into the discussion forum right now. There's a version in English, there's also a version in French and in Spanish. We invite you to complete the survey. It shouldn't take more than 5 to 7 minutes. We will also be sending the survey through our social media platforms. So if you don't get the chance to click on the link at this moment, you can follow up shortly. And really the survey is just to ask some of those questions that I've raised. Give us your feedback, give us your inputs, point us to resources and sources that we may not already be aware of, that we've not mentioned, and really thinking about your ideas about what you would want in a community. And then we will come back to you and then begin the co-designing process. So the link should be there, and you'll also have an opportunity to respond to the survey through social media. I'm looking forward to hearing from many of you, from getting this process started and working together so that we can really push forward the field of systems thinking in health policy and systems research in the context of global health system strengthening right now. So thank you very much. Daniel, I'll turn over to you. Thanks a lot.
Thank you, Aku. Thank you for the fantastic presentation and for sharing the need and the idea of this community of practice. Helen, I'm not sure if there are questions or comments in the discussion session that we should raise to Aku.
Not that I saw at the moment. Carmen, did you see others? Maybe not on top, but please feel free to raise any questions directly now for Aku to answer about SysTech. I think we had a lot of information now about the cataloging, the co-designing, and maybe really there are questions there.
Mm-hmm. Yeah, maybe, well, the questions are coming. I would like to stress, so I'm really thrilled and happy to see SysTech being launched, and because over my career, so I've been working as a medical doctor first, then with NGOs in the field and the ministries of health, and now more in academia, and I found fantastic system thinkers all over the place. There are people at every place in the health system. You find health professionals, you find managers, you find people at the community that are great system thinkers, and it's a pity that they don't have access to the support from their peers, and they don't have access to the different tools that we have presented today, and it's difficult for them to engage in and facilitate the application of system thinking in their environment. So that's one of the big points of SysTech, is to create this big community where we can support each other, similar to what we have done with Timor, Botswana, Pakistan, and us at the Technical Support Center, that we really learn from each other on a daily basis. And also to stress the idea of co-design. So there will be an opportunity for all of you that are interested to participate in how SysTech should be, and how SysTech should be named, what would be the objectives, how we could operate as a community, and this will be a process of 1 year probably to be able to co-design SysTech in a way that represents the different needs, the different perspectives. So Helen, if over to you. I don't know if there are questions already, or we can move to the next.
More. I think Carmen was also refreshing. No, I think certainly just to stress then at this point that it should be a very participatory process. So we really hope to continue this conversation. I think as Aku said, it's a soft launch now, but we really would like to engage with all of you. So please do not hesitate to reach out if you have questions occurring to you about this.
And Helen, I just wanted to say that I just launched the questions on what would be the motivation of people to join such a community of systems thinkers? What do they see as the value of this? And what would be the best modality? So it would be really great if you already engage and give us your opinions. I see already some votes coming in. So please, if you're still with us, we're just going to be in this session for a few more minutes. So the time shown is a bit too long. So bear with us. Like it shouldn't take us more than 10 minutes. So we would really love to hear what you have to say about this. Thanks.
And I think one question just came in directly to you, Akko, about practically how we would go about identifying and involving all the systems thinkers that there are at the implementation level.
Thank you very much for the question. So today, in filling out the survey, that's the first step that we will take to just populate this catalog. We will also be sending the survey through our networks, our alumni networks, our grantee networks, also making sure that we reach out to colleagues within countries. We want this to be as engaging as possible. And so we do absolutely want to include implementers, those who are in practice working on ground. And our hope is to cast the net as widely as possible. And once we have that interest and we look at the information that you have shared with us, then we will come back to you to then begin a process of engagement to be able to co-design the accelerator.
Thank you very much, Akko. And I think there's also a point going up just also to ensure the link as well to teaching in SysTech. I think Lucy is raising that. So I think certainly very, very well taken point. I would pass now, I think, back. I don't see any more questions coming in. I pass the word back to you, Daniel, for the wrap up.
Yes, thank you, Helen, and thank you all the speakers and presenters in this session. I think it has been a fantastic session. As Carmen said, I don't know what happened with the platform, but we planned for 2 hours, so we are at the end of the session. And yeah, so in a sense, to stress this idea of we are a community and we can help each other. And how we can do that is up to us. It's up to all of us how we organize ourselves, how we create a network of individuals interested in applying system thinking at any level of the health system. The global health arena is fragmented, and we need to bring people together. We need to break those silos of academia in one side, the implementers in the other side, managers in the other side, also without other sectors and other like education sector, all this climate change. So that there are many factors that will influence what we do, and we need to bring them together. And SysTech could be this accelerator so that it can facilitate all these interactions in a meaningful way. So we hopefully you see what you all 86% said that you will consider yourself system thinkers, and that means that probably you see the benefits of using system thinking. And at least from our view, from my view, I see system thinking tools and approaches as medicines, as drugs or needles or human resources. They are tools that can be used to save lives. If we build better design systems, we will save lives. We will prevent death in different populations. So if we use system thinking, we can make our systems perform better, and we can provide health and well-being to the entire population. So our just to finish, our vision is that in every corner of the health system of the world, in every health system of the world, system thinking tools are used and are applied to understand the system, to intervene in the system. And they are used as a routine activity. They are used as a routine tool, like you have, like planning tools, you have budgeting tools, so we will have our system thinking tools. That will be part of them. And hopefully people will be using them, and this will definitely have an impact on the performance of health systems. Just to say, reach out to us, please. Our emails are there. Probably you can reach out to us during the conference as well. We are happy to discuss, to engage with other groups, with other people on how to apply system thinking tools in different settings. And yeah, yes, I will close this session now, thanking again all the speakers for the fantastic experience, also the Alliance for helping us in implementing this exciting journey that we have had for the last year and a half. And thank you everyone for participating, and we are looking forward to meeting you in the future, either during the conference or afterwards. Thank you so much, everyone.